about ECG reads.
What about the ECG?
So the three-dimensional.
Okay. So we are here having the lead one from the right arm to the left arm. So it will like this. In this direction we have lead one, and we have the lead two from the right arm to the left foot. Okay, so this will be in this direction. This is lead two, and we are having the lead three from the left arm to the left foot in this direction. Okay, and now we are having three more augmented lines now. From the two in this direction we are having AVL, and from lead 3 in this direction we are having AVR. From the lead 1 in this direction we are having AVF. Okay, and we are also having the chest leads now. We are having the V1, and here we have V2, V3, V4 and V5 and V6 in these directions. So when we combine this together, this will be looking like this. Okay, so when we look in the inferior wall, that's it, like this. Which all leads are pointing towards this. We are having 2, 3 and AVF are pointing towards the inferior wall. So inferior wall is represented by the 2, 3 AVF. Okay, so when you look into the lateral, the high lateral area, high lateral wall, which all leads are pointing the 1 and AVL is pointing to the high lateral area. So high lateral wall is pointed by 1 and AVL, and the lateral wall is by the V6 and V5, and the anterior wall is formed by the V2, V3 and V4, and the septum will be by the V1 and V2. Okay, and when we look into the orientation of the heart is in this direction now, it will be. So which all leads are pointing to this lead 2 and AVF. So if you are here seeing the largest positive deflection, that's R wave, biggest one in 2 and AVF, it will be the normal axis. Heart is lying in this direction only. So what if you are seeing the biggest R waves in all these leads in 1 and AVL? So the biggest current is in this direction. So we can see the heart is oriented this way. So that is left axis deviation. And what if the biggest deflection in the AVF and 3? So the direction will be like this. So heart is turned to this direction. That is right axis deviation.
So then what about extreme right axis deviation?
So in the extreme right axis, the heart will be in this direction now. So in lead 1 and 2, it will be opposite direction. So we have a negative deflection in 1 and 2, and we have a positive deflection in the AVR.
Now you tell me about the causes of extreme right axis deviation.